in the early 2000s, there was a big study that came out that made people very, very nervous about hormone replacement therapy.
Regarding cancer?
Regarding a couple different things.
Heart issues too.
Cardiovascular disease, increased risk of heart attack, increased risk of breast cancer,
blood clots,
increased
perhaps?
risk of blood clots. And so the unfortunate thing about that study was it was a really, really big study. But the women that were in that study didn't start taking hormone replacement therapy until they were in their early 60s. We know that the average age of menopause is around 51. And so you're a very different woman at 51 than you are in your 60s. And so part of it is coming to see us when you start having symptoms, not waiting, and then talking about your own unique concerns. Many women, when they hear hormone replacement therapy does slightly increase your risk of an invasive breast cancer, a heart attack, a stroke, or a blood clot. Those risks are not dramatically higher than they are for everybody. But a lot of patients, depending on their family history, even if they've just had a close personal friend have breast cancer, they hear those risks and say, I'm just going to live with my hot flashes. The good news is there are a lot of other options that are not hormone replacement therapy that can help. Part of it is figuring out what is the most bothersome symptom. For some women, it's just vaginal dryness. They don't feel quite right down there on the regular, independent of sex, and they want to know what their options are for that. For some women, it's really the mood changes. The irritability and anxiety can be debilitating, and so there are other things that we might use for that. Some women may have a personal history of breast cancer, or maybe they had a blood clot during pregnancy, and so those are women where hormones are definitively not recommended, but there's still other options. And so it is one where it's a very focused, unique counseling session with that individual, but in general know that there are many other options beyond hormone replacement therapy that are open and can help with a lot of the menopausal symptoms.